Constipation is a common digestive issue that affects people of all ages. It's characterized by infrequent, difficult, or painful bowel movements. While most people experience occasional constipation, for some it can become a chronic problem. In this video, we'll explore how constipation develops over time, what causes it, and how it can impact your overall health. Understanding the progression of constipation is key to recognizing early signs and taking steps to prevent it from becoming a long-term concern. Let's start by looking at what happens in the body when constipation begins. Under normal circumstances, the digestive system works efficiently to move waste through the intestines and out of the body. The colon absorbs water from the waste, forming stool. Muscular contractions, known as peristalsis, help push the stool toward the rectum. When everything is functioning properly, bowel movements are regular and comfortable. However, when this process slows down or is disrupted, constipation can start to develop. Let's see what triggers this slowdown in the digestive tract. The early stages, constipation may present as mild discomfort or a slight decrease in the frequency of bowel movements. You might notice that stools become harder or more difficult to pass. This can be due to a variety of factors, such as dehydration, low fiber intake, or changes in routine. At this point, symptoms are usually temporary and can often be resolved with simple lifestyle adjustments. However, if these early signs are ignored, constipation can gradually worsen. Constipation persists, it can become a chronic issue. Over time, the colon continues to absorb water from the stool, making it even harder and drier. This leads to increased straining during bowel movements and a greater sense of incomplete evacuation. Chronic constipation can last for weeks or even longer, and it often requires more than just dietary changes to resolve. The longer constipation continues, the more difficult it can be to treat, as the colon may become less responsive to normal signals. Constipation can develop for many reasons. Common causes include a diet low in fiber, inadequate fluid intake, lack of physical activity, and ignoring the urge to have a bowel movement. Certain medications, medical conditions, and changes in routine, such as travel or stress, can also contribute. Understanding these causes is important for both prevention and treatment. By identifying the underlying factors, you can take steps to address them before constipation becomes a chronic problem. Fiber plays a crucial role in maintaining healthy bowel movements. It adds bulk to the stool and helps it retain water, making it easier to pass. Diets low in fiber are a major risk factor for constipation. Over time, consistently low fiber intake can slow down the digestive process and lead to chronic constipation. Including more fruits, vegetables, whole grains, and legumes in your diet can help prevent and manage constipation effectively. Water is essential for healthy digestion. When you don't drink enough fluids, the colon absorbs more water from the waste, resulting in harder, drier stools. Over time, chronic dehydration can make constipation worse and more difficult to treat. Staying hydrated by drinking plenty of water throughout the day is a simple yet effective way to support regular bowel movements and prevent constipation from developing. Regular physical activity stimulates the muscles in your intestines, helping to move waste through the digestive tract. A sedentary lifestyle can slow down this process, increasing the risk of constipation over time. Even simple activities like walking or stretching can make a big difference. Incorporating movement into your daily routine is an important step in preventing constipation and supporting overall digestive health. Sometimes people ignore the urge to have a bowel movement due to busy schedules or discomfort using public restrooms. Over time, this habit can disrupt the body's natural signals and make constipation more likely. The longer stool stays in the colon, the more water is absorbed, making it harder to pass. Listening to your body and responding promptly to the urge can help maintain regularity and prevent constipation from developing. Certain medications, such as painkillers, antidepressants, and antacids, can slow down bowel movements and contribute to constipation. If you notice changes in your bowel habits after starting a new medication, it's important to discuss this with your healthcare provider. Over time, medication-induced constipation can become chronic if not addressed. Adjusting your medication or adding supportive measures can help manage these side effects. Several medical conditions can lead to constipation, including diabetes, thyroid disorders, and irritable bowel syndrome. These conditions may affect how the digestive system functions, making it harder for the body to move waste efficiently. Over time, untreated medical issues can cause constipation to become a persistent problem. Managing underlying health conditions is essential for preventing and treating chronic constipation. As people age, changes in the digestive system can make constipation more common. Muscle contractions in the colon may slow down, and older adults are often less physically active and may take more medications. These factors can combine to increase the risk of constipation over time. Being aware of these age-related changes can help you take proactive steps to maintain digestive health as you get older. Emotional stress and changes in daily routine, such as travel or major life events, can disrupt normal bowel habits. Stress hormones can affect how the digestive system works, leading to slower movement of stool. Over time, frequent disruptions can make constipation more likely. Finding ways to manage stress and maintain a consistent routine can help keep your digestive system functioning smoothly. As constipation develops, symptoms can become more pronounced. You may experience bloating, abdominal discomfort, and a feeling of fullness. Over time, these symptoms can interfere with daily activities and reduce quality of life. Chronic constipation can also lead to complications such as hemorrhoids or anal fissures. Recognizing these symptoms early allows for timely intervention and better outcomes. Left untreated, chronic constipation can lead to several complications. These include hemorrhoids caused by straining and anal fissures, which are small tears in the lining of the anus. In severe cases, stool can become impacted, requiring medical intervention. Over time, these complications can cause pain, bleeding, and further disrupt normal bowel habits. Addressing constipation early is key to avoiding these issues. Chronic constipation can have a significant impact on daily life. It may cause discomfort, reduce appetite, and affect mood. Over time, the ongoing struggle with bowel movements can lead to anxiety about using the bathroom and avoidance of certain activities. This can create a cycle where stress and inactivity further worsen constipation. Recognizing the broader effects of constipation highlights the importance of early management. Constipation is not just an adult problem, children can experience it too. In kids, it often develops due to changes in diet, toilet training, or emotional stress. Over time, withholding bowel movements can make constipation worse and lead to abdominal pain or even stool accidents. Early recognition and gentle management are important to prevent long-term issues in children. Pregnancy is another time when constipation can develop or worsen. Hormonal changes slow down the digestive system, and the growing uterus can put pressure on the intestines. Over time, these factors can make bowel movements less frequent and more difficult. Staying hydrated, eating fiber-rich foods, and gentle exercise can help manage constipation during pregnancy. Long-term dietary habits play a major role in the development of constipation. Diets high in processed foods and low in fiber can gradually slow down the digestive system. Over months or years, this can lead to persistent constipation. Making gradual changes to include more whole, unprocessed foods can help restore regularity and support digestive health. Traveling often disrupts normal routines, including eating and bathroom habits. Changes in time zones, diet, and activity levels can all contribute to constipation. Over time, frequent travelers may notice that constipation becomes a recurring issue. Planning ahead by staying hydrated and choosing fiber-rich foods can help minimize travel-related constipation. Hormonal fluctuations, such as those during menstruation, pregnancy, or menopause, can affect bowel habits. These changes can slow down the digestive system, making constipation more likely. Over time, recurring hormonal shifts can contribute to chronic constipation in some individuals. Being aware of these patterns can help you anticipate and manage symptoms more effectively. Certain digestive disorders, such as irritable bowel syndrome (IBS) and inflammatory bowel disease (IBD), can cause chronic constipation. These conditions affect how the intestines function and may require specialized treatment. Over time, unmanaged digestive disorders can lead to persistent symptoms and complications. Working with a healthcare provider is important for effective management. Nervous system plays a key role in regulating bowel movements. Neurological conditions such as Parkinson's disease or spinal cord injuries can disrupt these signals and lead to constipation. Over time, these disruptions can make constipation more severe and harder to treat. Addressing neurological health is an important aspect of managing chronic constipation. Pelvic floor muscles help control bowel movements. Dysfunction in these muscles, whether due to injury, childbirth, or aging, can make it difficult to pass stool. Over time, pelvic floor dysfunction can lead to chronic constipation and require specialized therapy. Recognizing the signs early can help you seek appropriate treatment and improve bowel function. Gut microbiome, made up of trillions of bacteria, plays a role in digestion. Changes in the balance of these bacteria due to antibiotics or poor diet can slow down bowel movements. Over time, an unhealthy microbiome can contribute to chronic constipation. Supporting gut health with probiotics and a balanced diet can help maintain regularity. Chronic constipation is typically defined as having fewer than 3 bowel movements per week for several weeks or longer. Other signs include hard stools, straining, and a feeling of incomplete evacuation. Over time, these symptoms can become more severe and resistant to simple remedies. Recognizing chronic constipation early allows for more effective treatment and prevention of complications. If constipation lasts for more than a few weeks, or if you experience severe pain, blood in the stool, or unexplained weight loss, it's important to seek medical advice. Over time, untreated constipation can lead to serious health issues. Early intervention can help identify underlying causes and prevent long-term complications. Diagnosing constipation involves a review of symptoms, medical history, and sometimes physical examination or tests. Over time, if constipation is persistent, your doctor may recommend additional tests to rule out underlying conditions. Accurate diagnosis is essential for effective treatment and long-term management of constipation. Preventing constipation often starts with simple lifestyle changes. Eating a balanced diet rich in fiber, staying hydrated, and being physically active are key steps. Over time, these habits can help maintain regular bowel movements and reduce the risk of chronic constipation. Making small, consistent changes can have a big impact on digestive health. Drinking enough water is one of the simplest ways to prevent constipation. Water helps keep stools soft and easy to pass. Over time, consistent hydration supports healthy digestion and regular bowel movements. Aim to drink water throughout the day, especially if you're active or live in a hot climate. Physical activity stimulates the digestive system and helps prevent constipation. Over time, regular exercise can improve muscle tone in the intestines and promote more frequent bowel movements. Even moderate activities like walking or yoga can make a difference. Incorporating movement into your daily routine is a powerful tool for digestive health. Having a regular bathroom routine can help train your body to have more consistent bowel movements. Over time, setting aside time each day, especially after meals, can make it easier to maintain regularity. Consistency is key, and responding to your body's natural signals helps prevent constipation from developing. Stress can have a direct impact on digestive health. Over time, chronic stress can slow down bowel movements and contribute to constipation. Finding ways to relax, such as meditation, deep breathing, or hobbies, can help support regular digestion. Managing stress is an important part of preventing and treating constipation. For occasional constipation, over-the-counter remedies like fiber supplements or mild laxatives can provide relief. However, relying on these products for long periods can make constipation worse over time. It's important to use them as directed and consult a healthcare provider if symptoms persist. Long-term management should focus on lifestyle changes rather than medication. In some cases, prescription medications may be needed to treat chronic constipation. These drugs work in different ways to stimulate bowel movements or soften stool. Over time, your doctor will monitor your response and adjust treatment as needed. Prescription treatments are usually reserved for cases where lifestyle changes and over-the-counter remedies haven't worked. Biofeedback therapy is a specialized treatment for certain types of chronic constipation, especially those related to pelvic floor dysfunction. This therapy uses sensors to help you learn how to relax and coordinate the muscles involved in bowel movements. Over time, biofeedback can improve symptoms and restore normal function for some people. In rare cases, surgery may be considered for severe treatment-resistant constipation. Surgical procedures can remove blockages or correct structural problems in the colon. Over time, surgery can provide relief, but it's usually only recommended when all other treatments have failed. Your doctor will discuss the risks and benefits to determine if surgery is appropriate. With proper management, most people can control constipation and prevent it from becoming a chronic problem. Over time, adopting healthy habits and addressing underlying causes can lead to lasting improvements in digestive health. Regular follow-up with your healthcare provider ensures that any changes are addressed promptly, supporting a better quality of life. Even after constipation is resolved, it's important to maintain healthy habits to prevent it from returning. Over time, lapses in diet, hydration, or activity can cause symptoms to come back. Staying consistent with your routine and making adjustments as needed can help keep your digestive system functioning well. Keeping track of your bowel habits can help you notice changes early and take action if needed. Over time, monitoring your progress allows you to see what works and make informed decisions about your health. Simple tools like a bowel diary or symptom tracker can be valuable for managing constipation. Learning about constipation and its causes empowers you to make better choices for your health. Over time, staying informed can help you prevent problems and recognize when to seek help. Reliable sources such as healthcare providers or reputable websites are the best places to find accurate information. If someone you care about is struggling with constipation, offering support and understanding can make a big difference. Over time, encouragement to adopt healthy habits and seek medical advice when needed can help them manage symptoms and improve their quality of life. Compassion and patience are important as they work toward better digestive health. There are many myths about constipation, such as the idea that everyone needs to have a bowel movement every day. In reality, normal frequency varies from person to person. Over time, believing in myths can lead to unnecessary worry or inappropriate treatments. Understanding the facts helps you make better decisions for your health. Constipation develops gradually, often starting with mild symptoms that can worsen over time if not addressed. Factors like diet, hydration, activity, and underlying health conditions all play a role. Early recognition and intervention are key to preventing chronic problems and complications. By understanding how constipation develops, you can take proactive steps to maintain digestive health. Constipation is a common but manageable condition. Over time, small changes in daily habits can make a big difference in preventing and treating constipation. Staying informed, listening to your body, and seeking help when needed are the best ways to support your digestive health. Remember, you're not alone. Many people experience constipation and effective solutions are available.